guys, Dr. Christy Ennis. Today we are going to be talking about this big old pain in the butt, pun intended, the SI joint. Now we're going to go over the symptoms so that you know what you're experiencing, where it is a little bit so you get that idea, the causes so that hopefully you can change what you're doing a little bit so that you can not have this come back again. And then the exercises that I commonly use on myself, because yes, I have had this problem, and with my patients, to get you to feel much better. Now, that SI joint is between the hip and the back. So if you were to actually strike a power pose, which I highly recommend doing anyways, because it just makes you feel so good, but hands on the hips, I'm going to turn around. If I let my thumbs kind of drop in a little bit more, this tends to be where you're going to find that SI joint, okay? And usually, if you've got some issues here, it's pretty uncomfortable to let your thumbs poke around in there. I'm going to pull Bert out real quick here so I can show you that on the spine. But you can see this is the back of the hip. This is your sacrum right here. So this joint, right, that's your SI joint. Now, this joint has a lot of ligaments that surround it, as well as a bunch of different muscles, which we'll go over because they play a huge role. But a lot of times those ligaments get strained, and then you're only left with the muscles to kind of help you out and keep things stabilized. This joint is supposed to take that load, right? So it's supposed to be relatively stable. Like I said, the ligaments get strained and you've got either tightness or weakness in the muscles that surround it, then you're kind of in trouble. So how do those ligaments get strained? A few different ways. Number one, and this obviously won't apply to everybody, but if you are pregnant or have been recently pregnant, the ligaments actually get what we call laxity, so they get loose. So you can see then if that's got lots of ligaments with it, it's going to shift and tweak and pull and blah, okay? Number two, if you happen to be either walking outside like me and you're not really paying attention, or you're walking down the stairs and like me not paying attention, and you kind of do this little fall either into the hole or get that little trip, that little quick shift tends to cause pain and discomfort and movement in that area. Okay. Number three, if you tend to stand like this, or here's my sitting example, if you sit and you kind of slump forward, now you're tilting that pelvis, or if you sit and you're shifted to the side, now you're taking everything, right, and shifting it, right, because we're talking about that joint and the hip come to get that, that joint is the hip and the back coming together. So any movement through that pelvis is going to be an issue. Lastly, too, if you're lying on your side, if you're a side sleeper and you kind of hike one hip up, think about that, right? That's going to pull and tweak those things. Now, so number one is trying to fix your posture a little bit if you can. Sometimes I'll have people stand on two scales actually to make sure that they're not doing that. Now, this is an exaggeration, clearly, but to make sure they're not doing this. So you may feel, remember I already said pain here, but if things are shifted like that, you might feel like you actually have a leg that's shorter than the other one, right? So it kind of feels like you're walking like this, right? Walk this way. No, this way, right? You know what movie that is. It's such a good one. But so that may actually feel like one of the symptoms too. Besides pain there, you might feel like you're just kind of cockeyed, right? That's a professional term. So one leg can look shorter than another because of that rotation and that twist. The other kind of two areas that tend to be an issue are if this pain is here, right, if we're coming from one of these sides here, it can send pain down into the butt. Your piriformis happens to be one of those muscles that's attaching there, can even press on that sciatic nerve a little bit and even send pain down the leg, often just to the knee, not below. The other place that tends to get painful with this area being an issue that people don't generally think about, too actually, it can wrap around all the way around the groin. So sometimes groin pain actually comes from here, right? You think about your pubic bone is also part of that pelvis. These adductor muscles are attaching into that pubic bone, right? So we've got the piriformis, the adductor muscles. And then also these muscles along the side here and these muscles alongside the spine can also start to do this, and you tend to feel symptoms there as well. So if you check all of those boxes, it's probably pretty clear that that's where these issues are coming from, okay? So you got the causes, you got the symptoms. Yay, that's step 1 and 2. Now, what do we do about this darn thing? So I'm going to give you the first 2 exercises that I typically do on myself and with patients. And these two are to correct. Remember how I said people stand shifted? Okay? So pretend, and this is, believe it or not, yes, where my issues usually are on the right. So if it's my right side, a lot of times I'm going to be shifted to that left side. So we want to try to get back into that position. So here we go, over to the wall. So if I'm shifted to that left, I'm going to lean my right arm against the wall. I'm going to take my hand on my hip, and I'm pressing in towards the wall. You can even add a little head side bend. Now you want to be very careful with this. It might feel a little uncomfortable, but what you don't want it to do is cause pain to get worse in the leg. It might be a little more uncomfortable in the back, but if you have pain in your leg, you don't want that to increase with this, okay? That would mean this is not the right one for you. Hopefully you'll be like, oh yeah, Calgon, take me away. So 10 to 15 reps, roughly, of that one, okay? And then the one that I do typically after that is just to shift things around. So we're going to use our muscles to shift things around. Remember I said adductors or inner thigh muscles, right? Piriformis muscle. So some of the other glute muscles, hamstring, and then hip flexors also play a role. So if they're weak or tight, going to be a big problem in this area. And that's a lot of muscles to think about, okay? So we're going to use some of those to reshift things a little. So you're just going to find a chair or a couch leg or something sturdy. One leg is going to go up. I'm going to bring that knee out to the side. I'm going to just go in a little bit of an angle so you guys can see me a little better. Bring that knee out to the side as much as I can without pain. Now I'm going to press my leg in and my arm out. So I'm doing an isometric contraction while breathing. Hold for about 5 seconds or so, and then see if you can bring that leg out just a touch more. Again, you're going to push again 3, 4, 5 times. I'm just going to show you 3, and then one more. And then you're going to switch sides, same idea, okay? So letting that knee drop out, taking that same arm, pressing, let it fall open a little bit more if you can. And that generally guides how many times you do it. If I do this 2 times and it's just not going to go out any further, then you stop. And again, pain also is a guideline. Don't push for dear life here. Okay? So these 2, a lot of times, are enough to kind of reshift things and make you go, oh, okay, that feels better. If not, or if that's uncomfortable, I'm going to show you some alternatives here. I'm going to get right down on the ground, on my back. Now, if you can, you're going to bring both of those legs up. Sometimes, though, this alone is uncomfortable. So if that's the case, you can bring those legs down or even do this seated in a chair. So you've got options, okay? I'm going to bring my hands to the outside of my thighs. They're going to push out. Hands are going to push in. So I'm kind of mimicking a couple of the ones I just did. So again, roughly 5 seconds. Making sure, start to engage those abdominal muscles so that you can use that core a little bit, right, to help support you. Again, 3, 4, 5 times roughly. I'm not really moving much with this. I'm going to do the outside, and then I'm going to move to the inside. So you don't have to have any fancy equipment. You can take those fists together, and now I'm pushing my fist out and my legs in. Same idea, not arching the back, right? Keeping that happy neutral spine. Oops, I let my fist come together. You can always use a pillow or a ball here as well to help you kind of squeeze that. Okay? And then, again, if you can get your legs up, even better. One is going to go this way. The other leg is going to go that way. So if my right leg is pushing up, my right hand is pushing down. So now my left leg is going to go that way, left hand that way. So you're just opposing those. Again, a few seconds, and then it's a switch. So if this is too much, right, you just do, same idea. I'm really pushing up but not moving. I'm pushing down but not moving. Try to do the first one, but you can always do that if there's too much discomfort. So a little bicycle here, again, keeping those abs engaged. And again, just using those muscles to shift things around a little bit here. Good. Okay, again, should be feeling better. If not, now we really need to address those muscles that are getting tightened up, okay? So typically, it's the hip flexor muscles that are tight and some of the piriformis. The weakness tends to come in those glute max muscles and those hamstring muscles, some of the abdominal muscles, and yes, your pelvic floor muscles also play a role here. So those Kegel muscles or stop the pee muscles also need to be activated properly in order to support this area too. And sometimes they get tight too. So to get to these hip flexors and quad muscles, I'm going to pull out my Derma Edge, which is my device that I created and patented, and I'll link that below for you. But we're just going to get some blood flow going, right? So I'm just going, and you can almost see this probably. I'm a little bit bumpy here, which means that I have some restrictions. So I'm not pushing super deep, but again, just getting blood flow going, getting in through, you can almost see it turning red a little bit, getting in through all that front of that leg. And then I'm going to get in to the side and the back too, right? These tend to be the tighter areas. That's where I'm working on these first. As you're doing this, you may notice that, woo, that spot's really sore. So those are the ones we're going to hit next, okay? Do this until it just feels a little bit looser or a little less bumpy, yucky. Now, from a hip flexor standpoint, if I know exactly where mine is, right? But if you come to the top of that leg, and obviously it's right on the hip, but if you come below, right below the hip bone, this is usually the spot right here, and it almost feels like you can take your finger across it, and it's kind of yuck. So it doesn't feel great to use my fingers to do that, so I'm going to take the edge of this little Derma Edge, and then I'm going to add, you can see that just kind of twing there, right? I'm going to add a little bit of motion to it, so we're flossing the muscle to try to get it to release. Now, I'm on the ground, clearly, doing this, but you guys can try doing this also sitting. If it's not comfortable to get on the ground, don't do it. There's nothing wrong with that, okay? I'm going to move on actually to my glute minimus. The TFL is here a little bit, and even the glute medius, but they're all about in that same area. And to do this one, you can either stay sitting up like this, and again, taking that edge. You can add a little clamshell. This is my spot, you guys, right here. We go way back. So you can either do it in this position. If it's more comfortable, you can go right onto the ground and do it, right? And again, you could even do this seated. The key is to get into that spot and then add that rotation of the leg, okay? And then the same motion would be in that piriformis. So find that yucky sacrum spot, come down again, and then add that little rotation. Again, same positions. You can do it upright like this, lying on your side like I just was, or even seated. And again, do these on the bed, please, if the floor doesn't work for you either, okay? All right, so we've got some little resets. We've got some muscle work to help loosen all this junk up, and now we need to stabilize it. So I have found that doing double leg exercises standing, or even some single leg stuff but lying down, is the way to go to start. If you start doing single leg exercises like lunges or single leg deadlifts standing, usually because things are kind of doing this, it just takes it and does this a little bit more. You'll find even sometimes, right, like if you stand shaving or even just standing on one leg to reach will increase some of those symptoms. Excuse me, I have hair on my nose. So do try to avoid those for right now. So we're not working on the balance part yet. But one of my favorite ones to start with, heels together, toes apart. Oh, I'm lying on Bert there. Sorry, Bert. Hands down by your side, or actually, I'm going to actually use my elbows to help engage the lats too, which are another stability muscle. If I press those elbows in, I'm going to lift that butt up. Now I'm getting the glutes, and I'm getting, again, bilateral, right? Each side to help stabilize here. And just know also that this pain can shift back and forth, right? It's a pretty shallow joint. So it's good to do these techniques, especially those soft tissue ones on both sides. That's why doing some of those resets on both sides too. So about 10 or 15 or so, totally lost count, but you get the idea, okay? And then the other, excuse my swinging around here. The other one that's good to start with that typically feels okay are little side-lying leg lifts. I really gotta move, Bert. I'm so sorry, buddy. Okay. So if I straighten my legs out, I wanna just be able to see my toes and maybe a little bit of my feet. That's how I know I'm in a line straight. Bend that bottom knee because it's more comfortable. Turn that foot down, and then I'm gonna add that little lift. So again, working here to help stabilize a little bit. Like I said, most people are weaker here and tighter here, a little tightness here too. So that you're not spending all day exercising, it's good to start with these two exercises, and then as you get better, you can easily progress. So again, 10 or 15 reps if you can to start. Always use pain as a guideline, okay? The lastly two, sometimes I'm just gonna roll a little. This muscle also gets tight. I actually did a video on this. It's called your quadratus lumborum. I'll link that there so you can see how to release that one too, okay? Whew. All right, I just gave you guys a bunch of information, and not all of it will apply, but some of it definitely will. So please use the techniques that work for you. Click that thumbs up button if you like this video, and please subscribe. Thanks, guys.